Hey everybody, how you doing? This is Jason Root with Root Health, and today's video blog is healthcare insurance and fitness. I've talked about this before, so this might be a little bit of a repeat over some information, but it's important. So, anyways, healthcare should be a bit like taking care of your car. In the realm of insurance, your policy covers large acute incidents when dealing with car insurance. When you get into an accident, your collision comprehensive kicks in to cover you. This system enables us to spread the risk of economically impactful acute incidents across a large number of people. In healthcare, this is where medical care and allopathic medicine works great. So, allopathic being drugs and surgery, basically. If you break a leg, get cancer, or need surgery, this is a fine system. When taking care of your car, though, we still have to change the oil, get tune-ups, and take care of normal everyday maintenance. In medicine, this is where holistic care is needed to balance the body. Balancing the body balancing the body is just like taking care of your car. Maintenance can help to avoid acute emergency incidents. Drugs for minor issues such as rashes fall into this category as well. However, drugs and minor surgeries typically do not balance the body, but eliminate the symptoms of an imbalance. This does not mean that they have no value. Obviously, if one gets strep throat, one will want an antibiotic. But we should look deeper at the imbalances that cause disease and health conditions. This is difficult for doctors to do as they must take a high volume of patients to be able to meet their cost. This is a symptom of using insurance for primary care. Primary care, as a part of healthcare, is not the purpose of insurance, or is not the original intended purpose of insurance. For low-level everyday care, simple private paid care without a middleman in the form of insurance is a much better method, just as you would change the oil for your car. This is the major problem with our healthcare system. How expensive would car insurance be if the insurance companies had to pay and give you permission every time you needed an oil change or get a tune-up? How much would that oil change cost when the payments were channeled through a middleman as the insurance company? I have a lot of people asking whether medically oriented physical development programs are paid by insurance as a proactive measure. While this sounds like a good idea, and while we strive to have our services recognized as a major piece of the healthcare puzzle, the answer I give to those people is that you don't want them to be. This will drive up the cost of our services, not directly, but through premiums. As well, you would need approval for care that you don't have to get right now. Many chiropractors I know refuse to work with insurance, even though they have the ability to. There are very interesting private programs for both healthcare and physical development, whether that be fitness, prehab, performance. In the primary care, concierge care, where one pays a monthly fee and can visit the doctor as much as one needed, is fantastic. Though not all drugs or diagnostic procedures themselves will be included in the monthly fee. In physical development, a similar system is used by organizations, including my own. Also, healthcare savings accounts, or HSAs, are a great method to be used towards this means. In an HSA, income is put pre-tax into an account that you can use for concierge care, physical development, or other healthcare needs. However, many accounts work like insurance company where they will have to approve expenses. So that's the problematic issue that I have with HSAs. I really like the concept, but I hate when people have to get approved to use their own money, even though it's taken out pre-tax. Because there is a limit on the amount that they will allow you to take out and use for those, for those purposes. So this was just food for thought when approaching either how to strategize your own care or the consideration of healthcare systems being presented in our economy. So thanks, folks. I hope this was of some value to you. Contact me at that information right there. And if you need, and I hope you have a fantastic weekend coming up here.